Hello, I am Dr. Nalli R Gopinath. I am an orthopedic surgeon working in Apollo Spectra Hospital, MRC Nagar. I am a spine surgeon. Today I shall be talking to you about low back pain and spinal disorders. Why do people get low back pain? Around 40% of the population get low back pain because there are congenital problems or problems at birth. Around 40% of the population always have some problems in the lower back or the lower part of the spine. I'll show you an image. So this part, the last bone of the spine, can have deformities or problems in around 40% of the people. So such things can cause back pain. The other reasons for back pain are obesity, lack of exercises, bad postures or overactivity. There are some more reasons. Some people lift weights suddenly. Sudden lifting of heavy weights or frequent bending forwards can also cause back pain. So these are the reasons for back pain. What are the symptoms? How does the patient suffer from back pain? Usually they have pain in the low back. The patients can also have stiffness of the low back. Sometimes the pain can radiate or travel around the back of the thigh up to the toes or the legs. The patient can also feel some numbness occasionally, a tingling sensation, pin pricking sensation, and this is sometimes called sciatica. Patients can also have weakness of the legs. Sometimes patients can also have pain during nights. The pain can disturb them. They can get up in the middle of the night due to sudden pain. Turning to the sides while lying down can also be painful sometimes. Getting up from the bed, that can be painful. Sometimes pain is usually found in the early in the mornings, soon after getting up from the bed, and then it becomes all right over time. And how do you treat all this? When the pain is severe, the best thing is to give complete bed rest or a rest to the low back. So rest your back, lie down for around 24 to 48 hours. This relieves most of the pains. And then additionally, tablet paracetamol can be tried, which is usually given in a dose of 1000 milligrams once in the morning and in the night. So if it doesn't work, then you will have to meet a medical practitioner or a doctor or an orthopedic surgeon. Then what we do is we usually check the patients and then an X-ray of the low back is done. Then if it is normal or if there is any spasm or muscle catch or if the issues is low or less many times, usually around 90% of the people don't have big issues. Then we suggest bed rest again, rest from work. They have to take off from their work for a week or so. Physiotherapy in the form of heat therapy can be done. Also some tablets like muscle relaxants and painkillers are given. And we wait for around 4 to 6 weeks. So any back pain, if it is there for more than 6 weeks, then it requires an MRI scan to be done for the low back. Then the reason is found out, and then again some more protocols like bed rest and then lumbosacral belts and then change of medicines are all done. If the pain is really severe and then the problem is more, then we suggest surgery for the low back. Surgery for the low back nowadays is not very dangerous. It is very safe. The technology has improved a lot. So problems because of surgery is very, very less. Problems usually occur when patients come and meet the doctor very late. If they reach the hospital late, suppose the patient has numbness or weakness, and if they don't meet a doctor, then if the intervention or if the problem surgery is not done on right time, then the problem can persist for a very long time. So complications because of lack of meeting the doctor can be more than problems because of surgery. Then I'll show you some of these things. There are around 5 bones in the low back. Each bone will have a disc in between. So the lowest disc has to bear most of the weight of the whole of the spine. So the pressure is more on the lowest disc. The disc is like a washer or a shock absorber, so it can withstand weight. Usually it contains some water, so this water gives the bouncing effect. Usually after 40 or 45 years, the water can become dried up, and then that can cause problems after 45 years. So the best thing is keep yourself fit, do exercises, do walking, don't bend forwards frequently, don't lift heavy weights, and then Traveling also has to be limited. If you have a long travel, take good rest, give good rest to the back, lie down well. Don't sit in the same position for long hours. So you should always move out of your office. If you are sitting for a long time, for more than half an hour or 40 minutes, get up from the chair, go for a stroll, go for a walk, and then come back. So don't sit continuously, don't stand continuously, do exercise as well, take care of the back, sit properly, lie down properly, and the backache will not be troubling you for a long time. Thank you.